Are there any side effects to Paxlovid?
Yeah, very common side effect. You have this horrible taste in your mouth, metallic, nasty tasting. Besides that, symptoms are pretty minimal though.
What has the effectiveness been shown to be with Paxlovid for people dealing with COVID?
Yeah, it's 89% effective preventing serious illness.
Well, that's pretty good. So what's the time frame then if you are to be diagnosed, at what point do you need to start getting Paxlovid?
Yeah, the sooner the better. Within the first 5 days, after 5 days, it's not as effective. So day 1, day 2 is ideal.
And I read that there have been some concerns over COVID rebound with respect to Paxlovid. What do we know about that?
We're seeing a few percentage of folks that do have a rebound 4 or 5 days after finishing the pills. Those rebound cases tend to be milder, so not a big deal. I think if you have some concern about the drug and you think you need it, I'd go ahead and take it.
Do we know, is there any specifications on who it's recommended for versus who it's not?
Yeah, it's recommended for anyone age 50 and older, or anyone who's younger and has some type of comorbidity, other underlying medical condition, diabetes, heart disease, lung disease, any kind of immunocompromised condition also. You know, he's 79 years old, so he certainly is one who would qualify for drugs. Paxlovid, there's some IV drugs that are also available in certain circumstances. I'm sure the physicians are looking at what he needs to take. I'm glad to hear his symptoms are mild, but I think it'd be wise to have him watched very carefully and consider some treatment early on.
What's the difference between Paxlovid and we've heard a lot of talk about the monoclonal antibodies and the other sorts of treatments that are available for COVID?
Yeah, early on in the COVID pandemic, there were monoclonal antibodies that worked very, very well. They don't work well with the new Omicron subvariants. Paxlovid does. There's a new monoclonal antibody that's just come out. That might be a good one, although it's not in good supply right now. There's another one that doesn't work very well. The ideal drug right now is Paxlovid if you have symptoms. Another drug, Evusheld, that's if you don't have symptoms but have been exposed. Too late for that for Joe Biden, but that also works for people who've been around him.
And for that, is there anything specific that you need to do other than contact your provider and say, I may have been in contact with somebody?
Yeah, Evusheld, Paxlovid, both those require a physician's prescription. So you need to talk to your doctor about that and then find a pharmacy that stocks it. Not all pharmacies have these drugs right now. COVID indeed is increasing in this country significantly. It's up in 40 states I talked about earlier today. It's also, we're seeing an increase in hospitalizations now, which is of concern. Now, let me put that in perspective, up 20% from 2 or 3 weeks ago, but it's still a fourth of what it was around December, January. So not that many cases. Deaths are up a bit, 50 a week right now in America total. Used to be 400 a week back in January, February. So they're up a bit. Now, most folks who get seriously ill, and certainly the deaths, are folks that are pretty much the ones that are unvaccinated. Vaccinated folks do much, much better.
Do you have any concerns about what these numbers may do once school goes back into session? Because we're looking at that happening in the next couple of weeks.
Well, there's no question. This is a very, very contagious virus. It looks for every opportunity to spread. So as people congregate, whether it's in schools or any kind of indoor event, we're going to see more spread. I'm concerned about that. Fortunately, it is relatively mild. We might want to encourage folks to get out and get a vaccine if you haven't had one. If you haven't had one this year, you should probably get one or get another one. We know that vaccines work, but after 4 or 5 months, they tend to wane. And this BA.5, it can actually take advantage of that. And even if you've been vaccinated, if it's been 4 or 5 months, you are certainly susceptible. If you've had COVID, you have some protection, but that lasts typically a month or two only. So if you've had COVID, that's not going to protect you. You need a vaccine also.
In general, it seems that we've come so far. You know, I think about over the course of the last 2 years, now we do have these vaccines, we have treatment options. How much of a difference does that make just in terms of helping get life back to normal?
Yeah, I think we need to understand we're going to probably have to live with COVID from now on, just like cold viruses, just like influenza. Now with influenza, we get a vaccine every year. It's a new vaccine every year. I won't be surprised if we get a new COVID vaccine also once a year to prevent this from having serious consequences.